Welcome back. Clay Grimes and Mark Beals joins us. They are with Alaric Health and Fitness. Thank you both for being here.
Yes, ma'am.
Trying to find out a little bit more about your business and what all different types of services that you do offer.
Yes, ma'am.
So thanks for coming in. Tell us a little bit about yourselves.
So Alaric Health is a primary care office here in Jacksonville. It's owned and ran by two board-certified nurse practitioners, myself and Jim Whited. You know, we offer many things that we'll talk about as we go through this. The main thing just being that, you know, we can care for all ages, three and up, so we can really, you know, care for your family throughout the lifespan, and that's our goal.
Okay, that's very good. And where are you guys located?
We're on Edgewood and 17, so just north of FSCJ in Murray Hills.
Okay, very good. And tell us a little bit about what you do there, because I know you have a lot. He works out, obviously.
Well, I have a few roles. I work up at the front desk. I serve as the nurse practitioner's nurse. I help check in patients and do that. I also do all of the fitness training. I do some of the consultation as far as the bioidentical hormone replacement therapy. I get the process started for our patients, and then the nurse practitioners take over.
Okay, I want to get into a little bit more about the certain things that you do, and I know we have some pictures that you brought along. But I think there's, you know, what you just said. What is that?
We started a company called Materialised. It's bioidentical hormone replacement therapy.
Okay,
so essentially what we do is we'll take a sample of your blood, we'll send it off to a lab, and they analyze all of your hormones. Testosterone, estrogen, progesterone, cholesterol, all your vitamins, and we see where you're deficient or where you have too much. And what we do is we take those numbers, we put them into a calculator, and we optimize your hormones by placing pellets just underneath the skin that will dissolve over time and helps level off your hormone levels.
That sounds kind of scary to me. You know, when people hear you're going to like put pellets under our skin, but yeah, I guess it doesn't hurt, or you know, what does it do?
It's placed. They're about the size of a Tic Tac, and it's placed into the adipose tissue in your hip, which unfortunately we all have some fat down there. You know, all you ever feel is a little prick from the numbing medication. After that, it takes us about 10 minutes to do the whole procedure, and it's really pain-free.
Do they dissolve or something?
They do, typically over a 4 to 5 month period. That's dependent on how much you exercise. But typically over a 4 to 5 month period, your body's just constantly absorbing them from where they're placed.
Okay, so like if someone has a deficiency in a particular hormone, that's what they're getting.
Yeah, and it's mainly testosterone for males and females. That's mainly the one that we find that people are the most deficient in.
When is it that most men need to have testosterone? I mean, I'm not sure about this, but I think it's around like 60 or 55, something like that.
No, that's actually a misinterpretation. A lot of people feel that way. I myself, I'm 38, so when I first had my testosterone levels drawn, it was 300. And I've seen it in patients in the 20s as low as, you know, their testosterone level being 80 and 90. So it really just depends. A lot of it has to do with genetics.
Oh, okay, so it's something that you would inherit?
Yes, ma'am, that's the thought.
All right, and what is with the Botox? You also offer Botox, right?
Yes, ma'am. We do Botox for the office. We offer it to anybody. You can call and make an appointment. Our prices are fairly low when it comes to that. We offer Botox at just $11 a unit, or we have a special, what we call our VIP program, where we offer, you pay $100 a year to join the program, and then we lower the cost of the Botox to $7 a unit. So essentially after 2 treatments, the VIP program pays for itself. You know, we only offer a limited number of these slots available, so if you're interested, please give us a call. Okay. We do have a few openings for the upcoming year.
How often can we do Botox? Is it something that can only be done every so often?
So you can have it done every 2 weeks.
2 weeks?
Yes, ma'am. So if you came and say you're new to Botox and you came and got 20 units, you could come back in a minimum of 2 weeks if you needed more. If we was unable to get all the areas under control with just 20 units, that is available. And then it lasts, typically, you know, everyone's different, but typically 3 to 4 months is you'll get from one injection.
Okay. I remember when John Kerry got that, the politician. You know, I think a lot of people must be getting that right now.
Yeah, it's pretty popular now.
Are there any adverse you know, side effects with the Botox? What might somebody have if there's going to be a problem? Is it like pink eye or something. I remember Bob Costas was doing the Olympics, and I remember he had pink eye, and they said it might have been from the Botox.
Yeah, I have not seen that. You know, we do a pretty thorough job at our office. You know, we're safe. We make sure everything's clean. The problems that you do see every once in a while is one eyebrow could be a little higher than the other one, depending on where you place it, and all that's fixable with another injection.
Yeah, that'd be cute. Lopsided. They'd be like, "Are you mad at me?" No, it's just my Botox.
Yeah,
you know.
right.
Any final thoughts that you'd like to push?
You know, one of the other programs we have is the weight loss programs, health, wellness. Any problems that you have, please give us a call. More than likely, we have a program that we can help you with.
I think this is great. So you guys are just pretty much like an all-around facility that can, like, from age 3 up,
Yes,
and
ma'am.
weight loss and,
yeah,
and
that's the
cosmetic.
model.
And
Yeah, we think the model we have is great, and we want to continue that.
one-stop shopping.
Absolutely.
All right, listen, thank you both, Clay and Mark, for coming in today.
Thank you.
Hope to see
very
you back.
much. Yes,
Right.
ma'am.
All right. Next Tuesday at 7:30, you'll want to see the performance. There's a classic, A Christmas Carol. It will be at the Times Union Center, the Performing Arts. For ticket information, you can call the telephone number on your screen, area code 904-442-2929.